I'm starting to go bald. What do I do? Should I use Finasteride or Propecia? Hello everyone, Victor Sloan here. I am your hair loss support and lifestyle brother. This will be my second take of this video because I went through the entire talk of the video and it was not recording. So that said, I thought today that I would talk to you about Propecia, also known as Finasteride, being the main name of the drug. Now, Finasteride can be used to treat hair loss. It has been said that it can either slow down hair fall or possibly even help regrow by some. Now, that said, it does require a prescription. So you do need to go to your doctor, have your doctor check you out and see whether you are a candidate for taking Propecia or another brand of Finasteride. And that said, there are some potential side effects. There is definitely a high likelihood that it can treat your hair loss to some degree. It's tough to know what that degree will be, but there is a small chance of some side effects which may or may not, sour the pot for your decision on whether you want to go through with treatment via Finasteride. So, there of course is always a chance of allergic reaction, which is generally swelling and itching, especially of the hands, the mouth, the throat, and so this can always be a big problem. That's one thing that you'll just have to keep an eye out for, talk to your doctor. And but there are also the side effects, which are lightheadedness and dizziness. There's also swelling and pain of the breast tissue, and as well as under the arm, which technically I guess is still part of the breast tissue. There's also been documented pain in your testicles. That said, there are some more serious side effects as well, and I may miss some of the documented side effects as I go through this, but some of the more serious side effects that have been seen have been lower semen amounts, impotence, which means you begin to lose the desire or possibly even ability to have sex, as well as along with that there may be chances of anxiety and depression and all kinds of things which can affect your quality of life. That said, there is another medication which might not affect you as seriously, called dutasteride, which is in the same family. Now, hair loss treatment for dutasteride is an off-label treatment, but it is still known to help. It does seem that the effects are potentially more mild than Finasteride, given that Finasteride, it is labeled that you should not allow women or children to touch it because it can absorb into their skin and it can alter their hormonal levels. Whereas dutasteride actually has been approved for females to take, so long as they do not take it while pregnant, along the lines of the fact that these are hormone inhibitors, like these are anti-androgens, is that women are instructed to not take dutasteride while pregnant because of the fact that it can seriously affect the fetus, especially if the fetus is male. It can inhibit testosterone development within a male fetus, causing underdevelopment of genitalia or even full-blown ambiguization of the genitalia. And, these are potential serious issues here. But, for this video, we're not talking about female use, we're talking about the use for men for hair loss. So, there has been also documentation that though these medications have been used to treat enlarged prostate and have been even used to treat prostate cancer, there is a potential risk, a more rare risk, of increasing your potential for getting rare types of more serious prostate cancer. I will remind you, though, that these side effects are a small percentage of who they affect. Not everyone will be affected with any or all of these side effects. So there is a high likelihood that you can take these medicines to no ill effect. But the question you need to ask yourself is, are you willing to take that risk? I'm not trying to sway you in either direction. That decision is between you and your doctor, and possibly, you know, some members of your family as well. So, one more thing is that these medicines should not be taken with alcohol. You should not be drinking alcohol if you're taking these medicines. So if you do decide to go this route, you need to stop drinking for as long as you're taking these medicines due to potentially serious interactions between the alcohol and the medication. So now that I have presented this a second time, being the first time that you will see this, I hope that this video has been informative and can be one of many resources to help you come to the decision that best suits you. And I hope that you can find whatever solution it takes to help you find peace with your hair loss. So have a nice day.